Okay, here we are in part two of part two. We're talking about um, why does chronic pain develop and why is mindful movement such a foundational healing process. We talked a little bit about how pain spreads through neuromuscular and soft tissue changes. We talked about a case of a guy named Jim who started off with pain in his hand, started spreading to his arm, his shoulder, his neck, headaches, cognitive changes, digestive problems. Why is that happening? Why is this man spiraling down despite the best orthopedic care and neurologic care? Got the meds, got the physical therapy, all that. What do we do about it? So sometimes exercise actually helps the process. For most people, probably, when they have an injury, a fracture, even a nerve injury, a surgery, they go and they get the right kind of skilled exercise and it corrects those protective reflexes or it prevents them from happening. Some people, that doesn't happen. We don't always understand why. But some people develop this spiral where the thing gets out of control. That's where, in my experience, manual therapy can be incredibly helpful. Manual therapy can be delivered by a variety of different people: physical therapists, massage therapists, chiropractors, osteopathic physicians. All of those people have their sort of biases about how their thing is the best, right? My experience is that the best person or the best practitioner is the one you can get to and the one who's really sincerely taken their professional development and really studied. And that means studying the left brain stuff of understanding the anatomy and physiology, how things connect, like within the limb, within the region, within the whole body, how it connects to the mind-body connection. So they're looking at the whole you and not just having that myopic view that we often see where, oh, you got pain in your wrist, let's look at your wrist. Because it's more than that. It's this whole system. So lots of different practitioners are good at that. You want someone who's got that left brain knowledge, who's also got presence, who's also got the ability to actually tune in to what's going on a more subtle level and see the whole of you and work with the whole picture. It's right brain and left brain together. That's what makes a great practitioner. In my experiences, in many cases, that has been game-changing. To have the right kind of manual therapy to unwind the soft tissue restrictions, to re-educate those neuromuscular responses that are out of whack. That's incredibly powerful. It doesn't always work, and we should talk about why. So let's try to unpack this a little bit more. Let's talk about why sometimes even the best manual therapy doesn't work. So part of the reason why even the best manual therapy doesn't work sometimes, and certainly why good physical training and therapeutic exercise doesn't work, is that your bodily experience to pain, to stress, to trauma, to injury, it's not just in your body. It's a mind-body phenomenon. Your emotional state, your mental state is incredibly important. So we're talking here not just about your mental state and your emotional state at the time of injury, which is really important, but like who you were from the time you were born. We know that people who've had adverse childhood events, who've had early life trauma or serious illness, their fight, flight, freeze response gets locked into a hypervigilant mode. Sometimes it's as bad as being post-traumatic stress disorder. Sometimes it's just hypervigilance that doesn't meet psychiatric criteria for a disorder, but nonetheless their system is primed so that ongoing insults or things that happen that trigger later on in life create a much more sort of vibrant or exuberant stress response and traumatic response that is mental, emotional, and energetic that gets locked into the nervous system. There's a part of your brain that's called the cerebellum. And when I was training, we used to think the cerebellum was just really about motor coordination because it's involved very much in processing the signals that are coming from your spinal cord about where your muscles and bones and joints are in space and how much tension and length you have and everything, and integrating that with your motor system in your brain that says, hey, I want to move over here. More recent research is starting to show us that your cerebellum is intimately linked with your emotional experience. It's intimately linked with your limbic system, which is the place where your body biases you towards stress or relaxation, the place where your body mounts that alarm response that can come up in response to a trauma. And for people who've had early life trauma or who have a genetic predisposition, There can be even a more profound and strong stress response. So that gets locked into the movement patterns. It gets locked into the protective responses that are in the neurologic system and the neuromuscular system. Think for a moment about a time when you've been suddenly startled. You might have gone, right? Or think for a moment about what it feels like if you get really angry or really sad or feel really lost or confused or depressed or hopeless. That is a physiologic neuromuscular response. Your body moves in response to the way you relate to your reality. And most of us aren't really aware of that. Most of us are just walking around living aware from our head up, thinking about reality, but not necessarily feeling it. But meanwhile, your whole body is having a response. And that's part of what gets locked in, not only at the time of that traumatic injury, but also in your day-to-day life. And if you've got chronic pain and it's creating a whole bunch of emotional and mental distress, whatever those emotions are, fear, anxiety, depression, blame, shame, grief, that is feeding into your neuromuscular responses. And so if you're expecting that just having some physical treatment is going to fix you, you might be mistaken. And for many people, there is a piece of inner work that's about consciousness and awareness. It's about mindful awareness. It's about learning how to perceive what's happening in present time, in your thoughts, in your emotions, in your bodily sensations. So let's take this a bit deeper, because this whole aspect of mental, emotional, bodily responsiveness, we've been talking about it in terms of neuromuscular and soft tissue responses of your motor system. But it's actually much more rich than that, and that can be for good or for bad, depending on your situation. What we understand now is that there's a deep integration of your stress and fear and reactive and protective circuitry of your brain with other aspects of your biology. The research has been building for 10 or 20 years, and most notably talking about what you might call the brain-gut immune system. And it's one system. It's intimately connected. It's studied as separate systems, but we're seeing more and more how those are so profoundly interconnected, you can't create a line in between them. We're knowing more and more that chronic or acute stress, fear, anger, depression, anxiety, negative mind states are communicated immediately to your gastrointestinal system. And they can evoke various changes, like changes in the natural healthy bacteria that live there, changes in the appropriate balance of permeability that should be there in your intestine that can lead to a breakdown of that, so that your intestine starts leaking proteins and molecules that shouldn't get exposed to your immune system but do, and that creates immune reactivity. Also, those interchanges in your gut lead to changes in the way all the bacteria in your body are producing and metabolizing your food, producing neurotransmitters, producing various kinds of chemical messengers that circulate through your system. They go to your brain, they go to your organs, they affect your hormonal systems, and they affect your immune system. So it's this, I'm sorry, and just adding to that, right? So those second messengers of stress, those molecules that speak from your gut to your immune system that communicate with your brain, those themselves can trigger things like anxiety, OCD, depression, even psychosis, mania. Various sorts of really serious mental illnesses can come from this feedback loop. So the core of this, the core trigger, is this biology that says, I'm in danger, I'm not safe. And that comes from your perception, whether it's your mental emotional perception or your actual physiologic perception. That danger signal feeds into your entire biologic system. It can shift your body towards low-grade inflammation, which can start perpetuating other disease processes in any organ system in your body. So that includes the changes in the brain that develop and create brain fog, depression, anxiety, like we talked about, changes in the brain that create widespread pain where the whole body becomes sensitized, create fatigue, create brain fog, contribute to changes in your heart function, development of cardiovascular disease, neurodegenerative disease, potentially diabetes. Like, it's one system. And chronic inflammation, chronic I'm in danger, perceived by your mind and body, perpetuates those disease processes. And you have a neural network in your entire being that is learning constantly from this experience. And if your body has been going along day after day, month, year, living this biology of threat, vigilance, danger, gastrointestinal immune changes, and dysfunction and inflammation, that is part of the progression of chronic pain. That is part of the progression of chronic illness. And so that's part of what you can empower yourself to start to unwind and unpack. And it's a mind-body process of learning and re-education, and there's lots of ways to do that. And that's what this video series is talking about. Okay, so we know the topic of the day. The overall arching topic is mindfulness and mindful movement and chronic pain and chronic illness. Let's talk about that and how that impacts this biological process. Okay, so we're going to cut right now to make these videos in easier digestible chunks. We're going to go to part 3, where we'll talk about, in light of all these changes we've been discussing about really what generates chronic pain and chronic illness, what can you do about it? And what is this whole mindfulness and mindful movement really about in terms of making that shift to start helping you heal from the inside out?